And we're back. Oh, girl, that was a good break, honey. Yeah. Shit, all the good talking and shit that we just did. Yes, ma'am. And that's why you take a break. All right. You know, it's funny. Like I always do when I do podcasts. It's like we take breaks and we're like, oh yeah, and then we get back to being serious. Like work, bitch, let's do it. You know, we were talking before we left about mental health, and we were getting into it with access, which is a major key when it comes to getting the problem solved. The access of getting the resources, the access of getting shit done, basically. So let's talk about that. You know, recently, and I can only speak from my experience, I've been having like these pause where I blank out. I just blank out. I had like, disclaimer, if you deal with like self-harm, step away from it a little bit. But I had 2 friends pass away from self-harm recently. And it kind of, you know, it kind of like broke me down a little bit. And it kind of like put me in the space where I needed to get the resources and help. Access. I got so many phone numbers, girl. Ciao, when I tell you I got phone numbers, I got like 25 phone numbers.
Wow.
And I couldn't get through to getting the help that I needed. So let's talk about how can we change this? Like how can access be something more easy to access?
For me, you know, just to add to that, you know, when we produced the We Are Here campaign with the X Clinic at Common Square Health Center, for me, it was about how can we utilize our voices, our stories, our experiences to empower each other to pick up access, right? When I first moved to Boston from South Florida, I lived in Mattapan with my aunt while I was going to school. And to get on the red line, to get on the trolley at Mattapan Square, to get on the red line, to get downtown, to go to like, you know, my provider, it was a lot, you know, and I think that we have to have local, community-based resources that are like literally on Warren Street that are around the corner from us. And to me, I feel like we have to start to look at healthcare and access to healthcare not as a privilege, but as our birthright.
Do you think we should adopt? The United States is the only first world country that doesn't offer the same access as these other countries. So you think we should adopt like Canada's systematic process, Denmark's, England's, as far as giving free education, free medical care, and the only time, because the way that their system is set up is like the only time that you really pay is when you go and you're sick.
Right.
So you think that the United States should adopt that?
100%.